Hey guys, welcome back to Meds Made Easy. My name is Tarun Verma. Today we're going to be talking about Adderall, also known as dextroamphetamine. It is used for the treatment of ADHD, attention deficit hyper disorder. Also used to be known by like ADD before, attention deficit disorder. It works by, they don't really know the exact mechanism by which it works, but theories are, and the understanding is that it increases dopamine and norepinephrine in your brain, which helps you focus and gives you energy. So, I'm not going to go over dosages. Dosages get really crazy with Adderall. You have extended release formulations, you have liquids, you have immediate releases. So it can be dosed 1 time a day, twice a day, 3 times a day. I've even seen it up to like 4 times a day at lower doses, not the high doses. For the immediate release formulations, it generally kicks in about 3 hours, and it really has its main effect between the hours like 4 to 6. The extended release formulations, those kick in about, hit its max peak in about 7 hours, and it's good in your body for about 8 to 12 hours. It works pretty effectively. All these medications stay in your body quite a while. The half-life or the elimination, and let me explain that, it's about half the medication will leave your body in about 13 hours for either formulation. So we're looking at each dose staying in your body for about, over 24 hours. So that's just something to keep in mind. If you ever get drug tested, it's something it's going to flag in your drug test as particulates that end up in the urine. Let's see here, what else do we need to know? If you have any sort of renal or hepatic issues, make sure that your doctor knows. These things need to be kind of titrated and monitored on their dose. It's a pregnancy class C, which means you have to kind of talk to your doctor and really weigh out the benefits and positives. Generally in pregnancy you don't see this that often because it can cause issues. It's definitely a no-no in breast milk. If you're breastfeeding, you do not generally take this medication, or you stop taking this medication while you breastfeed, because this will get to the baby, and then the baby will be wired and have those effects, and we don't want that. Why? Mainly because this medication is a Control 2 medication. It is highly addictive. The abuse potential is high. More than likely, half of you that are watching this for the reason of just taking it to study and to get through exams or focus at work, and not actually because you have this issue of ADD, ADHD. And so the abuse potential is so high. We see it all the time in society. Just don't do it. If you're prescribed to take it, then take this medication. Definitely, please do not party on this medication. Do not take this other drugs, alcohol, all of those. It's just a recipe for disaster when you're taking uppers with downers. It's just going to be harmful to your body. Let's see, I'm going to put up a list of the common side effects up here. When patients come up to me and they go, my kid is on it or I'm on it, how do I know if it's working too well or not enough? What do I need to watch out for? Sleep is the #1 thing. If you're taking this medication and you don't go to sleep till a lot later than your normal bedtime, that's a sign that this medication is working too good, meaning we need to back off the dose a little bit, lower your dosage down. If you're falling asleep too quickly in the day, that's a sign that you're not getting enough of this medication, or you're losing your focus, or you get groggy after about 3-4 p.m. or something like that. Those are the things to watch out for, especially with this medication. Your blood pressure, people who have blood pressure issues, you got to watch out for it, because it'll make your heart race. Because why? Because this medication is a stimulant. It's going to stimulate you. It's going to stimulate your body. It's going to stimulate your heart and all other organs. So you need to watch out for that. Also, another sign that your dose is too high is jitters. Do you have jitters? Is your body jittering? That's a classic sign that you're on too high of a dose. So I guess, guys, I like to make these videos short and under 5 minutes. So I think I covered all the basics here. If you have any in-depth questions, please leave them down below. Subscribe to the channel, let us know how we're doing. And if you have suggestions for other videos you want us to do, there's a million medications out there. We try, but it'll take us a couple of hundreds of videos to get through every medication on the market. So if there's one that you want us to do, kind of like Vyvanse, we got a request for Vyvanse, let us know and we'll do the video for you guys. This is what it's for. We do it to help people so they get educated about their medications. Anyways, guys, thanks for tuning in to Meds Made Easy. We'll see you next time. Bye.